Here, we see that it's 13 millimeters at the start and arterial end. That means that because of blood pressure, we drive that water out of the capillary. And then, as the blood pressure starts to drop, it's almost become a suctioning force, right? That suctioning force allows you to drive in 7 millimeters of water back in. Most of the areas, most of the fluid that we don't reabsorb at the venule end will be reabsorbed by the lymphatic capillary. So then if we are kind of in good shape, we will have 100% of the water over here being reabsorbed. So we never have a buildup of that interstitial fluid. Now, edema and capillary exchange. What can cause us to have edema? If capillaries become more permeable, i.e. the spaces between endothelial cells increase, proteins can leak into interstitial fluid, increasing our interstitial colloid osmotic pressure, ICOP. So what happens is this, right? There are certain things that can lead us to have more fluid buildup or edema. One of those things is, for some reason or another, the spaces between our capillaries, those simple squamous cells, usually they have very small gaps. What happens if the gaps are bigger? If the gaps are bigger between the cells, now proteins can leak out of your bloodstream into your interstitium, right? Into that space found between your bloodstream and your cells. So that interstitial fluid now has a lot of proteins there. And now those proteins start to attract more water from the bloodstream. As it starts attracting more water, you'll start having more and more edema. Now, this type of edema is really noticeable in the legs, right? Have you guys ever heard of the term pitting edema? Edema can be pitting or non-pitting, right? Pitting edema is this, right? I see your legs are pretty big, and then I look at your tibia, and I put my finger in that area that's edematous, right next to tibia, and I press inwards. If my hand or my finger moves inwards and it leaves a depression, that's pitting edema. If I push in and then I remove my finger and it comes back and springs back, that's non-pitting edema. Pitting edema is usually caused by excess amount of proteins in that interstitial fluid, which leads to more water going into that area where you have more protein, right? And it can be caused by certain conditions. One, hyperthyroidism, right? It can cause pitting edema. Now, what other things can cause increased edema? One, release of histamine. Histamine is a vasodilator. Being a vasodilator, it spreads out your simple squamous cells. If you stretch out the simple squamous cells, the gaps between the cells enlarge, causing more water to leave. It's more filtration. So the more filtration, the more water that stays in that area. And you'll have a problem with edema. What other things? Decrease in plasma concentration of proteins, like albumins. Two different conditions. One, liver disease, right? Cirrhosis of the liver. What's the most common cause of cirrhosis of the liver? Alcoholism, right? Alcoholism is 1, 2, and 3 in America. What happens with alcoholism is this. Your liver starts to fail. They're no longer producing albumins. What occurs is your solute concentration in your bloodstream is predominated by albumins. So albumins play a big role in the solute concentration in your plasma. When the number of albumins starts to drop, the solute concentration in your plasma starts to drop as well, right? Now you don't have as much solutes to keep water in place. Water wants to go to areas of higher solute now, and that's your interstitial fluid. Water from your bloodstream, the plasma, will start leaking out because it's going to an area of higher solute concentration, right? Without albumins, your solute concentration in your blood is too low. Because of that, water escapes your bloodstream and goes into your tissues. This is why you see people having just massive ascites, right? They have the beer gut. Some people are like proud of it. And then you'll have massive edema in the lower legs as well as a result. The other time we might see a problem with protein is this, right? It is something that some of you might have heard of, right? There's two conditions that usually is a sign of person not being healthy, and that is marasmus and Kwashiorkor. Most of you have never heard of either of these, marasmus and Kwashiorkor. Kwashiorkor, and it's a terrible picture, but it is a picture right here, right? Marasmus is a lack of calories. This is your basic malnutrition. You have failure to thrive because you don't have enough calories, right? This is what we see in droughts and famines here. This is marasmus. Kwashiorkor is different. With Kwashiorkor, the babies, the kids usually have enough calories, but because they don't have enough amino acids, because they're not eating enough protein, the liver can't make the albumins, right? You need the amino acids from diet to make all the albumins. And when you don't have enough of those amino acids, then you have Kwashiorkor. And it acts and is very similar to what we see with people with liver failure, where right, the causes of low albumin is different, right? In liver failure, the liver is failing. Well, in Kwashiorkor, you just don't get enough protein in your diet. And because you don't get enough amino acids brought to the liver, and you don't make enough albumins. What happens then? All right, these kids, I was gonna say babies, but I don't know, all right? These babies right here, right? They look like they are chubby because their abdomen is so distended. In reality, that's ascites. That's abdominal edema. If you look at the legs, it's also slightly edematous, and they have poor wound healing because you don't have enough amino acids and proteins. And with this, with Kwashiorkor, they get enough calories to survive. And what we have done in America now, and UNICEF, is that they have given these kids a lot of protein bars. And protein bars then are used as a means of getting that excess amount of albumins and proteins in diet. The problem is, they're not always the best tasting protein bars. So if you ever had protein bars that are dry, they're not exactly great tasting. So some of the kids don't want to eat it. Peanut butter is another way of bringing that excess amount of, more proteins through diet, but protein bars are easily the easiest way. The reason why is they don't perish easily, so they can last longer in the heat, and they're, easily transported, right? Again, all we have to do for Kwashiorkor is just give them enough protein. Once you get enough protein, this goes away. This is not a sign of worms or any kind of parasite, right? I've heard that from other people in my class, like, oh yeah, the abdomen's distended, right? They have worms or something. No, it's not a sign of worms, it's just a protein, right, malnutrition here. And that's all we have to do is give these kids protein and they will just become normal again. The problem is if they've had this lack of protein for a long, long time, they're gonna have a failure to thrive, and they're not gonna be the same height as kids their normal age in America. So when I was in Africa, I saw lots of kids that were 16, 17 years old, and they were and they're really short, 5'3", 5'4". And at that point, if you're 17, 18, it's really hard to, kickstart your growth rate. So they're gonna stay short at that point. The last type of thing that can cause a lot of edema are blockages of the veins. If you block the veins right here, coming out. So for some reason or another, blood should be pouring out through the venual end, but if you have a blood clot right here, or some kind of atherosclerotic plaque, what happens is blood has a harder time getting out. If blood has a harder time getting out, you're gonna make it more filled up in the capillaries. The capillaries gets more full and distended, you'll have more water loss. Again, anything that can somehow increase the size of the capillary, all right, or stretch the cells, means that they have a larger gap and more water loss. And the biggest one we're gonna see is, right, blockage or removal of lymphatic vessels. That is our elephantiasis. With elephantiasis, and I did see this, all right, the legs are 3 to 4 times the normal size. And when we went to certain areas of the bush, and we're talking about 50% of the men having this, right? So it is, you can imagine trying to walk around to this. And we'd have people that walk 3-4 miles to come see us, and they're having one leg becomes this large and that heavy, right? So the other leg's fine, thank God, and then one leg's affected usually. If you have both legs that are affected, then we have an issue, right? Walking becomes really, really hard. Yes?
That picture up there with that lady, big leg, yeah.
Right.
How does that happen the same way with obese people?
Yep, very similar, right? When people that are greater obesity, we don't call it normally elephantiasis, we call it lymphedema. Elephantiasis is specific for getting an infection that affects your lymphatic system, right? So that's elephantiasis. This lady has lymphedema, right? And you see it in my 600-pound life, and you'll see those people get huge legs, right? And they have every now and then like something that sticks out of their abdomen that's monstrously huge too. And what happens is those areas, because they're not moving, because they're so large, there's decreased blood flow in those areas. And you stretch the capillaries in those areas because you have so much blood and they're not moving. As you stretch those capillaries, there's more fluid loss. At that point, right, you're not going to be able to, bring it back, right? You're going to have to debulk it, and hopefully they can lose weight too. So this is elephantiasis, and it's caused by an infection. Now, so usually they have a picture of the parasite. There it is. This is it. This worm goes into your body, and usually it can enter by cuts, small little cuts in your foot. As it goes up, it goes into your lymphatic system and goes up the lymphatic vessels. And once it goes into your lymphatic vessels, it stops that movement of lymphatic fluid, so then it goes and we can return it back into your veins, right? So then all that fluid that we should bring back no longer gets brought back. Right? Now, it doesn't seem like a lot, only 10% is brought back. But that 10%, when you multiply it by how many minutes a day, how many hours in a day, well, it becomes a lot of fluid you're gonna start to no longer mobilize. It just stays in that one area, causing that area to become larger and larger. Now, in America, when we do have people with this kind of lymphedema, and it's not that large, like we saw in that other lady, right? Usually, you see, in America, and again, people with, especially used with people with double mastectomies. Every now and then, you'll see somebody wearing this, a nude colored sleeve. Oh, yeah. This is a lymphedema sleeve. What happens is this, right? This sleeve is tight, and because it's tight, it forces excess water and fluid, in the interstitial fluid, right? Forces it into the veins, so then you can reabsorb more, right? Now, usually it works pretty well, but if you have somebody that takes your blood pressure and that arm that's affected, yeah, it's not gonna work very well. First of all, you probably won't be able to get your arm in that sleeve at that point, because your arm is so swollen. And what they usually do is use those ACE bandages at first and wrap it really tight to at least get some of that fluid down before we can put a sleeve back on. Right, we talked about venous return before. Again, right? When we see this, I want you to understand what's happening here. When we mobilize blood from the legs, the deep veins of the legs right here are close to your skeletal muscles. And because they're close to the skeletal muscles, as you contract, the rhythmic contraction and relaxation of the muscles allows you to move the blood upwards from your lower leg to your inferior vena cava. All right? That combination of muscle contraction and the valves. All right? As you contract, the muscle, the veins next to the muscle start to eject blood upward. right? As you relax, the blood comes back down, but you have valves there that prevents it from going all the way down. So with each cycle of contraction and relaxation, you move it from one segment of the vein to the next segment. You contract again and relax, and move it up another segment. So the more cycles of relaxation and contraction, the more we bring blood upwards towards the inferior vena cava. And then the respiratory pump is when you take a deep breath and hold it, so then you can bring blood back into the heart. There's a reason why our respiratory rate not only increases when we work out, but you take deeper breaths, right? And it is very uncomfortable first when we first work out, because your heart rate's increased, and more importantly, your respiratory rate goes from 6 to 12 to 35. That's a massive increase. So what happens? Well, that helps both moving oxygen and it helps moving blood. All right, let's take a little break.